An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.
Hello everyone, welcome to Dr. Chan's Minor Ailments Forum again. So if you have listened to the last week's show, you would remember that we talked about the treatment of type 2 diabetes briefly. So at the beginning of the diagnosis, we can try diet-controlled treatment first, and if it works well, it can be lifelong. However, disease tends to progress, and then we'll move on to tablets, another form of type 2 diabetes treatment. So you might ask, what would happen if you've been on several different medications, one after another, and the diabetes control is still not ideal? Are there anything else out there? The good news is there are several different kind of things that you can try if all tablets are not working very well. So I'm just going to take this opportunity to bust some myths and give you some tips on type 2 diabetes treatment and also a little bit on the driving side of things. So there are two things that we can move on to after medications are not doing very well for the diabetes. So number one things that I'm going to talk about is injectables. It's relatively new drugs, and I'm really excited to tell you a little bit more about this, and also insulin's injection. Now, from the name injectables, you can imagine that this medication is given via injection. However, the good news is it's not insulin, so you don't necessarily need to check your blood sugar before every single injection. However, it's always good to keep an eye on your blood sugar to ensure that you're not going into a hypo, which I'll tell you a little bit more about what is hypo. There are several different kind of injectables out there with different names, but more or less they are of the same nature, which is of a drug called GLP-1 analog. And once you've got this hormone on board, let's say you've done the injection, what it does is it'll tell your pancreas to release insulin, which will help to move the glucose out of your bloodstream and into your cells so you can actually use the energy. And it also limits the glucagon production from the liver and also promotes liver to store sugar. And another exciting thing is that the drugs also help to slow down your digestion. So all in all, what would happen is when we start a patient on this kind of injectables, we will realize that they start to lose weight. And in due course, in the 3 months blood test, you'll see that the HbA1c has much improved, which is a main goal of good diabetes control. So you can imagine that this medication would be really good for the patient who are, for example, has a higher BMI and also have a busy life. So they only need to do some of the medication are only one injection only, and some are twice only, and then they can get on with their life and go to work or do the things that they need to do. And I must say that during day-to-day consultation with my patients, it is a little bit hard to kind of tell them that why don't you go and try some injectables or even move on to insulin, as the control of the diabetes would be much better than a number of medication that they're on at the moment. I think one of the fear is mainly a disruption of life, maybe, because they think that what if I need to eat and I need to do an injection, then I have to go away to a toilet to kind of do it secretly because I don't want to do it in front of everyone. And this is kind of like a barrier for them to take injections on board. And actually, you can imagine that if you only need to do it once a day, as long as you do it at the same time every day, then you can get on and go and eat out. It doesn't really matter thinking about when you're going to do the next injection. So that is definitely something for a diabetic patient to consider if the control of diabetes is not very good. And I think another reason for people not wanting to have injection is that they are needle phobic. So they don't like needles. Then I think that's fair enough for them to not to have this medication, because that would be in a way of torture, really. But for those who've got no problem with using needles, I'll highly recommend, if your diabetes is not very well controlled, maybe you should consider either injectables or maybe moving on to insulin injection. As someone who actually prescribed this medication, I have tried to see how a needle feels like, and I must say it's pretty painless, and I think it's something that people can get used to easily. And personally speaking, I've got loads of patients that I've started them on injection that they came back and said, I feel like a completely different person after I've been on injections. So I think if you can remove the initial barrier and give it a go, then you realize the benefit of these kind of new medications. Now, I would like to take the opportunity to talk about insulin on its own. Because although injectables are very good and it's a new medication, at the end of the day, sometimes some patients' diabetes are very poorly controlled, and the only way that can make the HbA1c come down would be the use of insulin, as it's the most natural kind of treatment in a way, although the injection is not the natural part, but the component is natural, because this is what we need, is insulin to kind of help us to digest food and store energy and so on and so forth. I normally would recommend that if your HbA1c is hovering about 70 plus and you're on a mixture of medication or even on injectables and it's still not really shifting down, then I think insulin would be the next medication of choice. You know, when you mention insulin to the patients, they suddenly or immediately will say, no, I don't want that. And there's several reasons why I totally understand why they would say that. Number one is the inconvenience that they're worried about. You know, when you talk to friends who are on insulin, you might realize that they need to do it every mealtime. Sometimes they have to do it while they're taking a snack, and some might have to do it before bedtime. So there's several different regimes. But the reason for different regimes is because of the situation of the diabetes and also the lifestyle as well. So not everybody has to do injection several times a day. It doesn't work like that. And quite a lot of the time for patients who are type 2 diabetic, if we do start the patient on insulin, it probably would just be a before bedtime insulin as a basal dose that works throughout the 24 hours. And that on its own might be able to give it a boost to a better control of diabetes. Another myth that people hear about diabetes would be, I really worry about being hypo if I'm on insulin, because I've heard a story from my friend who's on insulin and he had a hypo and he collapsed. Well, hypo is a very important thing that we need to get to understand. Hypo actually means a hypoglycemic episode, which means that your sugar dropped too low for the body to function properly. So the symptoms tends to be blurred visions, anxiety, irritable. Sometimes they become very sweaty, they might slur the speech, they might complain of feeling really hungry, and they feel confused and drowsy. And shakiness and weakness, definitely one of those, and some people complain of headache as well. I think for all diabetic patients, we have to be aware of these hypo symptoms, because if you catch it early, you might be able to stop it to progress further. So for example, if you have these symptoms, either you're on tablets or on injections, I would advise you to check your blood sugar straight away. So if your blood sugar is less than 5, then that could mean that you're going through hypo. And if you have any fast release sugar available, for example, some chocolate or some sugary drinks, then I would advise you to take some and then recheck your blood sugar again in about maybe half an hour to an hour to see if the number is coming back up. Now, the interesting thing is hypo doesn't only happen if you're on insulins or injectables. It's actually happen with some of the medication that you take orally for diabetes as well. For example, a class of medication for diabetes called sulfonylurea, or the drug name glycoside. They have the potentials of reducing your blood sugar to a level that might cause hypo. So in that case, it is very important for people who are on that kind of medications, or especially on insulins or injectables, to check the blood sugar before they drive. As in recent years, it became a law, and you can check it on DVLA, that if you are on drugs that potentially can cause hypo, then you should check your blood sugar before you drive. And if the blood sugar is less than 5, you're not allowed to drive. And that applies to long distance driving as well, because you need to stop regularly to make sure that your blood sugar is at a safe level to continue the driving. So in that case, it's always good to have a blood sugar monitoring with you when you are doing driving. It is even better to have those kind of machines that actually record the previous reading, so you can have a record of it. And if you don't have that kind of facility, it doesn't matter, you can always write it down in a book. Now we touched on to driving and insulin, and it automatically makes people worry about, if you're on insulin, can you still drive? So let's just talk about Group 1 drivers, which are the people who drive cars and motorbikes. So if you're on insulin, it doesn't mean that you can't drive at all, but you must tell the DVLA to let them know that you're on insulin, and they will renew your license according to your situation every 1 to 3 years. And obviously, during this period of time, if anything happened, like for example, change of a medication, or if you had a hypo or anything like that, you need to report to DVLA. However, if you're on a non-insulin medication, that will be including the injectable. Injectables are not insulin medication. Then you don't necessarily need to inform the DVLA unless you have had 2 episodes of severe hypoglycemic episode within the last 12 months. Now, what is severe? Severe would be that you have no control and someone else needs to give you the hypo medication. Now, this also applies to people who has got no awareness or impaired awareness of hypoglycemic episode. So that means that you don't even know you're going to have a hypo. Or if you were driving and you experience a hypo while you're driving, and these will need to be reported to DVLA. I think the people who are affected the most in the case that they need to be on insulin would be maybe group 2 driver, for example, people who drive buses or lorries. Now, I have to make it really clear that even though if you're on insulin injections and you're a group 2 driver, it should not really affect your career. It wouldn't stop you driving. It will only mean that if you are on injections of insulin, then you will need to undergo an independent medical assessment every year. And to be honest, if you are a group 2 driver, as long as you're on any diabetes medication, you will need to inform the DVLA anyway. It is also essential for the group 2 driver who is diabetic to have a blood glucose machine that stores the number. And also when you attend for the assessment, you need to provide 3 months of continuous meter readings in order to support your applications. And same as the group 1 drivers, any change of the medications or the condition, it will need to be reported to the DVLA. I hope that in the past 12 minutes or so, I've clarified a few things about the worrying factors about diabetes. You know, how people think that if you're on insulin, that means your diabetes is really, really bad and that's the end of the road. I would say not at all, actually, because insulin is the only thing that can provide the best control of diabetes. I know it's a bit of a hassle of needing to inject, but let's say the diabetes is really badly controlled right now, and you could either go one way to slowly add different kind of tablets on top, and eventually it will reach a maximum effect, which is still not ideal, or we can actually go straight onto an insulin injection to provide the best control. And I always use the analogy for my patient. Let's just say if you have to go to London, either way you're going to go there. So you can either take the A road, which takes absolutely ages, or you can just take the motorway, which take you straight there. I don't think that this is the best analogy, but this is what I normally use, and I think that you can do a better one than mine. Whereas you can see, diabetes is a massive topic, and I don't think several sessions of 15 minutes is going to be enough to tell you everything about it, which I won't. But I think that this is just the beginning for you to understand the seriousness of this condition, and it's actually expanding in our countries. And the people who are actually diabetic who are listening, or if you're listening but you know there's someone who's got diabetes, maybe you should have a chat with them and make sure that, you know, the diabetes control is good, they're having a good lifestyle in order to prevent further complications. If you see, most of the people who are diabetic have no symptoms whatsoever and they feel quite well, and by the time that they do have any complications or any symptoms, that might be a bit too late. So once again, thank you for tuning in to my show. So next week I'm going to talk about, does man flu actually exist, as this is one of the requests from our audiences. Until then, take care of yourself. Bye-bye.
An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.